Welcome to the Medicaid Application Process for the Elderly, Blind, Disabled webinar. I'm Charles Bentley, Medicaid Eligibility Consultant for the Department of Health. Today with me, Anna Leonhard, who is our FSD Correspondence and Information Specialist that acts as a liaison to FSD for mental health patients. She's based here at DMH Central Office. With us, when you send in problems or questions or have problems with applications, usually she's the one that'll be sending you emails telling you what needs to be done. First, I want to start with just some basics about how a person qualifies for MoHealthNet. To be eligible, a person has to be in one of 8 eligibility groups and meet the requirements of an eligibility category. To be either age 65 or over, that's referred to as aged, blind, have a disability, be to the age of 19 or 21 if in state custody, parent or other caretaker relative of a low-income child under age 19, a woman breast or so cancer treatment diagnosed by the Show Me Healthy Women program, or a former foster child under the age of 26 who foster care after turning age 18. A person MoHealthNet by the Department of Social Services Family Support Division, Children's Division, or Division of Youth Services, based meeting the requirements of an eligibility category. Once identified in the MoHealthNet division system by MoHealthNet Eligibility Code, referred to ME code for short. There are just a few categories with very limited or restricted coverage, but most categories provide the same basic benefit package. 75 ME codes in use. 6 are state-funded programs with a limited benefit package. 10 are categories with a benefit package restricted to specific services for the CHIP premium program. The 55 are federally matched Medicaid categories that provide a benefit package that is based on the category the person's in, on whether the participant is a child under the age of 21, an adult, pregnant, blind, or in a nursing facility. This is all of the MoHealthNet ME codes that do not cover DMH services, either because the category is a state-only funded category or restricted to a specific benefit package. All of the ME codes that aren't listed here cover CPR services, STAR services, and DD waiver services. If you're working with a consumer that only has active coverage in one of the ME codes on this slide and they need DMH services, you should assist them in applying for Medicaid, most likely disability, just like you would a consumer that has no other coverage. One exception to this is a blind pension recipient who's in ME code 02. Since the blind pension program provides a cash benefit of $738 in addition to MoHealthNet coverage, if the consumer applies for Medicaid, the Family Support Division would close the cash grant before opening the other category. So recipients who need DMH services, you contact me so we can contact FSD to see if they can do an override to allow the client to receive both the blind pension cash grant and the federally matched Medicaid in another category that will cover our services. How the aged, blind, and disabled categories are identified by the Family Support Division, along with the codes that go with those categories. MoHealth, blind, and disabled, which here referred to as MHABD, include categories of spin down, non-spin down, vendor facility coverage, the AB special income limit group, people based on being in 1619A or B status, and disabled children. Clients JBD are assigned to ME Code 11 if they're age 65 or over, ME Code 12 if they're blind, and ME Code 13 if they're disabled. The health assurance category is ME Code 85 if the client has to pay a premium for coverage, ME Code 86 if they're non-premium. Care provides cash grant and Medicaid to residents of residential care facilities, assisted living facilities, and non-under nursing facilities. If the person is age 65 or over, there'll be an ME Code 14. If they're blind, they'd be an ME Code 15. If they're disabled, they'd be an ME Code 16. Supplemental Blind program provides a cash grant and fully matched Medicaid in ME Code 03 to low-income persons who meet Missouri's definition of blindness. The blind grant, ME Code 02, provides a cash grant and state-only funded medical assistance to blind persons who are assets that are too high to qualify for the Supplemental Aid to the Blind program. The waiver program, or Sarah Lopez waiver, is ME Codes 33 and 34 for children with severe disabilities who meet the need for DD waiver services. Slide lists old age assistance, aid to the permanently and totally disabled, and aid to the blind. These are conversion categories for clients who were receiving those types of cash assistance in December 1973. The model of the SSI program and would have received a lower amount of cash assistance under SSI than they were receiving under the old state program. Those recipients have guaranteed conversion rights to Medicaid and the state grant to supplement their SSI grant. While receiving in December 1973 can't apply for those programs, we talk about them because the rules serve as the basis for the MoHealthNet for the age, blind, and disabled Medicaid category. QA Qualified Medicare Beneficiary Program, M55, only covers Medicare cost sharing. The Specified Medicare Beneficiary Program, called SLMB or SLMB1, has the ME code as the only benefit is payment of the Medicare Part B premium. How important to note that people on SLMB1 are allowed to receive Medicaid in another eligibility category. The Qualified Individual Program, QI, also referred to in Missouri as the SLMB2 program, also has no ME code, as the benefit again is the payment of the Medicare Part B premium. The SLMB2 and SLMB1 is that a person who's on SLMB2 cannot receive other Medicaid coverage. If a person would be determined for SLMB2 and Medicaid, likely with a spend down, they would have to choose, do they want their Medicare premium paid or do they want coverage for their other medical services?
If an individual has an ME code that's not acceptable for DMH, they can apply for MoHealthNet and be eligible for both. The blind pension, ME code 02 or 03, contact Charles Bentley so that an override, is that right?
If they're an ME code 03, that covers all Medicaid services just like the majority of the other ME codes. It also gives a blind cash assistance grant. The ME code 02 is the one specifically for blind pension that provides the state-only benefit that wouldn't cover DMH services. So if you have someone in ME code 03, you don't need to do anything. They have full Medicaid coverage. If you have someone in ME code 2, that's the ones you need to contact me about so we can the steps and try to get an override done so that they can continue to receive the blind pension grant and get the Medicaid, replan the Medicaid category that would cover our services. earlier, to be eligible for Medicaid in Missouri, a person has to be in one of 8 eligibility groups to be potentially eligible. 2 of those have eligibility determined based on being in other programs. Those are the breast and cervical cancer treatment group, which is based on having the cancer diagnosed by the Show Me Healthy Women program, and the category that is for former foster children under the age of 26. Screen for potential eligibility for the other 6 categories, there are 7 questions that you need to ask. If those 7 questions is yes, then you should assist the person in applying for MoHealthNet. The questions are, is the person under the age of 19? Is a pregnant woman, person the parent or non-parent caretaker of a child under the age of 19 who lives in their home, is 65 or over, is a person receiving SSI or Social Security disability benefits, does the medical condition other than substance use that prevents him or her from maintaining ongoing employment at the current time, is the parent. If the answer to any of those questions, is no, then the person isn't going to be eligible. But if the answer to any of them is yes, the person is potentially eligible, and you should assist them in submitting a MoHealthNet application. Now I'm going to go over to Anna, and she's going to go over how to find the application and how to complete the application and some special procedures for helping DMH consumers apply.
I'm Anna Leonhard, and I'm a Correspondence and Information Specialist with Family Support Division, assigned here at DMH Central Office to assist with DMH consumers. How to apply, there are a couple ways. You can apply by mail online or drop it off in person, and you can also apply over the phone, although we will still need a signed application for that, so they'll mail it out to the client. You can access. Can you change slides? Sorry. Okay. So, the applications to either get the web application or the paper application to download and print out by going to dss.mo.gov and clicking the Find Medical Coverage, which is highlighted on this slide. There you have the programs we have, and typically you're going to be picking people with disabilities, seniors, blind or visually impaired. And the application is used for all 3 of those groups. So you can just go ahead and click people with disabilities, which will take this screen, and you can apply online, which will take you to the web application. Click paper application, which will download a paper application. Then you need, if the client is not receiving SSD or SSDI, that's Social Security, Supplemental Social Security, or okay. You'll need the accompanying form, so you want to click the button. Which will take you to the disability questionnaire is the most important thing to download, and also the Authorized Representative form, which we'll get to in a minute. The disability questionnaire is also called the MRT packet, and it's up of the disability questionnaire, the work history for the past 10 years, hospitals, medical facilities, and physicians seen, authorization for disclosure of medical information. And email in the paper application, and I'll get into that in a little bit. It's just sort of a general overview. For DMH consumers, we kind of have a different process, which I'll get into in a minute. Okay, application, that's the first page of the application, and that has that call center phone number. Page of the application is the front that you're going to start filling things out, or the DMH consumer will start to fill things out. If you're authorized representative, you can fill it out for the client, and then you'll need to submit that authorized representative form with it, and get into that in a minute as well. So on this page, the client fill out name, address, mailing address if it's different, email address. We're working towards having more web support where they will email information. It's not all up yet, but it's coming. Preferred method of contact, call, text, email. We need the social security number, date of birth, place of birth, gender, some optional. Important is here in this next section, it says any of these that apply if you or your spouse want. So, we over the age of 65, we are disabled and get Social Security, Disability, or SSI. We are disabled and do not get Social Security, Disability, or SSI. We are blind or visually impaired, and we live in a nursing home or similar facility. Most typically, we see people checking that they're disabled and get Social Security, or that they're disabled and they don't get Social Security. If they don't get Social Security, we do an MRT packet that I talked about earlier. If you're in a facility, you want to list the facility name, facility address, and then down here, so if the client is working, you want to make sure you check the box that says, we work and pay income taxes and want coverage under the Ticket to Work program. Ticket to Work allows people who have a higher income to have a premium that is lower than a spend down, depending on several criteria. And the other important thing that also always you should check is we need help with medical bills from the last 3 months. And that's also called prior quarter coverage. And if the client any unpaid medical services, including DMH services, in the last 3 months, you want to check that, and you want to make sure that you include the verifications for those previous 3 months. So that would be bank statements and income most typically. Okay. And this is basically if you don't request prior quarter at the time of application, but you realize after the fact they've been approved, but they really did have unpaid medical bills in those last 3 months, you can email me, as long as it's been a year since the approval date, and we can get the verification of income and resources. I can go back and approve for prior quarter. If they're disabled, get Social Security or SSI? When do you, the second box is the question. And if they are Security, Disability, or SSI, that's when you would check that box.
That would be when you have a client who's under the age of 65, and when you have a client who's under the age of 65, and they're applying then based on disability. By checking that box, it shows FSD that they're not going to have to establish disability because it's been established by Social Security.
When do you accept that? When do you check the help by paying co-insurance box?
That would, if you have anybody who is Medicare Part A or B, and they have Medicare Part B premium. There are some special programs, that's where we talked about the QMB, the SLMB program that we'll talk about more later. That if they're asking for assistance to help pay those premiums. You can check that in addition to the other reasons for applying. And people do.
At the back of the slide presentation, you guys will all get a copy of, but she's also going to type it out for you. Okay. Prior quarter coverage, if possible, you want to include those past 3 months of resources, checking and savings account balances, and income. But if you don't have those available, don't stop submitting the application, because we, again, have up to a year after approval to do prior quarter. So you don't want to get into May and then prior quarter will go back less than it would if you just submitted it when you had the client with you. Okay, so section 2, the household, and starts by saying list anyone in the home starting with the spouse and check who is applying. Good practice to also just write the client's name here again. I know it says list your spouse first, but it's not a good idea to duplicate it and check again that they're applying so that there's no question when the processing worker gets it. You list the spouse that's in the home. If the applicant is under age 18 and living with a parent, the parents must be listed in the home, including step-parents, and also any siblings or step-siblings in the home. To include parents or siblings if the applicant is age 18 or over, and you need to include any roommates or any other family members. So section E is money available to you, and this should be your cash, bank accounts, stocks, bonds, trusts, prepaid burial plans, etc. It should be, again, that core group, the client, their spouse, if applicable. If under age 18, then we would need their parents and siblings that are home. If, like, for example, you have someone whose case is they're getting Social Security payments and that's going into a parent's account and they don't have their name on a parent's account, don't put that on the application unless they're under age 18. They need to be able to access that. I've seen recently where people are putting parents' bank accounts on the application. We penned for that, and then we never need it. What if they're participated or under age 18 but married with a child and they live with the parent?
Okay, all right. We'll get into the eligibility criteria a little more later, but if when you're applying for a person for the Medicaid based on disability, if you have say you had a 17-year-old who's applying based on disability and she also has a spouse, then you're going to put down the 17-year-old and her spouse. You're going to list them. So happens to be living with her parents, you would also list them. Then we have to go into some special processing rules for that situation. But you have to list the person's spouse if they're in the home, because their income will be considered. The person is maybe living with their spouse and also living with their parents. I believe parents' income doesn't count. We'd have to check that a little further, and we'll give you a written answer on that. But I believe that's the way it works. An unusual situation.
Do people who have dependents who are living with non-family members fill out as if they are a family of one? Yes. So we've got a 25-year-old living with his parents, and he has no children. He does not list his parents on that application. He lists as if he is by himself. The person is 18 and still claimed on parents' taxes. Do you include parent income? Not from MoHealthNet for disabled. We don't pay any attention to tax status.
Once they turn age 18, they're considered an adult for the Medicaid programs for the elderly, blind, and disabled. So it's strictly on the person and their spouse. Okay.
Sectors, income and expenses, and again, only include income information for the applicant, their spouse, if in the home, and the applicant and if the applicant is under age 18, their parents, if their parents are in the home. So again, if you've got a 25-year-old living with his parents, we don't need to know his parents' income. Don't put it on there. It's just going to confuse whoever's working on the case. And complete the expenses section if the applicant is in a skilled nursing facility and has a spouse living at home. Section 5 is citizenship and residency. Check yes if the client's a resident of Missouri with no definite plans to move from the state. That means if they say, someday I'd love to move to Hawaii, just mark they're living in Missouri, that they're a resident. Check yes to citizenship if appropriate, or enter immigration information. Check yes if the applicant will apply for other benefits such as Social Security, SSI, or VA. And this is a requirement. They're going to request this. So if the client has not yet applied for Social Security, you want to go ahead and, again, don't hold up the application for it, but you want to apply for Social Security, and you can do that online, and you can get a printout that says you've scheduled an appointment, and that's all we need. We don't need you to actually have attended the appointment. Once you get an appointment letter, you can submit that, and that shows us that the client has begun the application process. Sex is no property. Answer questions about transfer of property, vehicles, real estate, and personal property. Section 7 is answer questions about life insurance, Medicare, long-term care insurance, and other health insurance. If the client is residing in residential care, assisted living, or non-Medicaid nursing facility, or applying for blind cash assistance, answer yes or no about direct deposit of benefits. Is specifically for blind pension and supplemental aid to the blind. So if your client is not blind, just leave that section blank. Okay, so now talk about the Authorized Representative form. A client may designate an individual or an organization as the Authorized Representative for MoHealthNet by completing the IM6AR form, which is available on the DSS website, on the pages with information about different eligibility groups, and from a link on the DMH Medicaid Eligibility page. And so where the Authorized Representative, the big bonus is that you'll receive copies of all requests mailed to the client. So letters, requests for information, action notices, any of that will be copied to the Authorized Representative. It can also have multiple Authorized Representatives, so there's really no reason, if the client is willing, not to be the Authorized Representative. And let's see here. So it shows the Authorized Representative form. And you're going to want to do is the client will fill out section 1, so list their names, address, their date of birth, or their DCN, and then they'll say who they're appointing as the Authorized Representative. And practice is we now allow organizations to be the Authorized Representative. So, for example, Places for People. So they write Places for People as their Authorized Representative. Then you get down to these boxes. They need to check how to apply for MoHealthNet coverage and acting on our behalf if we get MoHealthNet coverage, including annual reviews and reporting changes. This allows one from FSD to talk to the Authorized Representative, who would be a representative of Places for People or from Places for People who's representing the client. Let's see here. Client also fills out section 2. The other important thing is the spouse must sign. So if they have a spouse, the spouse has to sign as well as them, or we can't accept the representative form. So that's section 2, they sign, their spouse signs if they have a spouse. And then section 3 is for a specific person is assigned the Authorized Representative. If you're doing an organization like Places for People, just leave section 3 blank, and then the organization representative will fill out section 3 with the organization or facility name, the address where you want the copies of mail to go, the email address, that'll typically be whoever the main point of contact's email is going to be, and the phone number. Again, that's going to be most typically the person who's going to be working with the client and who will be able to answer questions. The authorized representative signs and dates. I need to my private health insurance in Section 7 covering my disabled son who is covered under this insurance.
If the person applying for Medicaid is covered by insurance, then you would list that insurance on the application form.
Application time limits. Once the application is submitted to the Family Support Division, applications are to be processed within 45 days for the aged, that's age 65 and older, and 90 days for the disabled and blind. Applications can be longer if the delay is not the fault of the client, such as waiting on medical records or other information from a third party. The current policy requires 2 requests to be sent before an application can be rejected for failure to provide verification. If requested information is received after the rejection but prior to the original due date, the client can be approved without submitting a new application. So into the rush cover sheet, which is something that I've developed with Charles Bentley over the last couple years, working with Greene County, who is the processing county for MoHealthNet for disabled applications. The community mental health centers, C-STAR providers, and DD case managers can use for some DMH consumers applying for Medicaid based on disability to submit the application and, if needed, MRT packet and medical records directly to the Family Support Division Processing Center in Springfield. The cut and flow chart for what it is appropriate to use are available on the DMH website, Medicaid eligibility page on this slide, and we'll be giving you this slideshow through email. And to talk through the flow chart, we don't have one slide for it because it's kind of big and it wouldn't fit. But basically, it starts out with, has the client already applied? If the client applied, don't submit another application. Mail myself for Charles Bentley, and again, those email addresses will be at the end of the slideshow. If it hasn't applied, you want to ask yourself, is the client a DMH consumer needing MoHealthNet as quickly as possible for their well-being? If they don't need insurance right away, they're not in a hurry for whatever reason, just cover sheet, leave that option open for someone who might need, their medication as soon as possible. So if yes, they need it as soon as possible for their well-being, ask yourself, does the client receive Social Security, SSD, or SSI? If they do, then you want to assign yourself as the authorized representative if possible, or assist with gathering any other verification like income or Direct Express account or bank account, and then the application using the rush cover sheet. If they're not getting SSD or SSI, you want to assist them with completing the MRT packet and with application. If you have records which show disability, you want to gather those. Part of the MRT packet's a release form, and that allows you, you get to FSD, then they'll turn around and send it back to you asking for the records. So some people are able to just cut that extra step and just get those records and submit it all at the same time, which is going to be the quickest way to get coverage for your clients. So you want medical records your agent has which show the client is disabled, especially a recent psychological evaluation signed or co-signed by a psychiatrist or licensed clinical psychologist, and paperwork showing the global assessment of the functioning score.
Just one question. Do we need
to complete the Authorized Representative form to be able to email you about a specific No. So if you're so I'm sort of a special case. A lot of people won't talk to you in FSD if you don't have that auth rep form, but I'm specifically here to work with you. So medical records need to be within the last year. They need to be within the last 6 months if possible.
I'll go.
And over that further. Charge on that stuff. Can public administration?
No, I think we've specifically set up the process that would be submitted by DMH agency that's working with the consumer. So we don't want you allowing outside people, even public administrators who may be the guardian, to use the rush cover sheet directly. If you have a consumer that has a guardian, it's a public administrator, you could have them fill it out or sign the application, then give it to you. Then you, as the agency that's working with the consumer, would submit the application they complete it using the rush cover sheet. But specifically for the DMH agencies to use.
Okay. So you want to use the rush cover sheet for DMH consumers who need Medicaid as quickly as possible when your agency is assisted in completing the MRT packet and has medical records that show the client is disabled or will be assisting in gathering the needed verification, or the client is receiving SSDI or SSI. So picture the rush cover sheet. Most important thing here is make sure you have the most recent one. I'm in the process of making a fillable one where you'll be able to fill it out with a PDF. And so you want to check pretty regularly to make sure you have the most up-to-date one, because we are continually improving it to better streamline the process so Greene County can process these applications as quickly as possible. So I suggest we have a link to it in the slideshow. I'd suggest checking the link rather than print a bunch out and keep them. That way you make sure you have the most up-to-date one. So, and you'll be filling this out. Don't ever give these to the client or to anyone else. You want to put the client name, their date of birth, their DN if at all possible, a GAF score if you've got one available, and then the agency provider name, the address, the contact person, one you want them to contact with any questions, usually the auth rep in a perfect world, phone number, and contact email address. So these boxes here, and it's really important to check all the boxes, make sure you fill it out as thoroughly as possible. Again, this is making sure Greene County can process this without any questions. So you mark that you've got the application. You want to include the Authorized Representative form whenever possible. You want that complete MRT packet if the client's not receiving Social Security. And we have it broken down. We need the disability questionnaire, work history, work history again. So we're continually updating this, and the most 650, and proof of application to SSD, SSI. And then we have our medical behavioral health records included. If you don't include those, we want you to check one of these other boxes. So either the client's receiving SSD or SI, that's why you're not including them. We're going to later, for some reason, you can't get them with the application. You want that application in as soon as possible. So if you can't get them right away, that's fine. You can mail them with another rush cover sheet to this email address, mrtpersonnel@dss.mo.gov, or fax it to the fax number provided if the application has already been submitted. And don't send anything but medical records to this email address, because they'll just get right back to you and tell you you've got the wrong place. If there are no records available, you can check that box but it's going to cause delays on the case. So at that point, you might want to reconsider using the rush cover sheet. They're not going to be able to process it as a rush. And then it definitely helps speed things up is that IM-6DA, the medical report, including a physician's certification/disability evaluation. And then there's a notes box. If you're including any verification, not a bad idea to just write bank statements included or anything else you want in that space. The application is for any DMH consumer that's being assisted by a DMH agency or provider representative. So anyone can use. Okay, so here's a screen that's kind of new. This is checking a case status. So you're always welcome to email me. Again, email at the end of the presentation if you have any questions. But sometimes I just get a question, have you received an application, or what's this case pending on? And it can save time. You can just check on the case status. So the client or authorized representative can enter date of birth, social security number, or DN to check the case. So you just enter it in and click continue. And so here are some examples. So this is an initial application pending on verification. So you see it says status application. It'll list the household members. Application information, it's an initial application, the date it received, and the date it's due. So go back to that the previous note. If the case rejects, but it's not at the due date, if you can get that verification in prior to the application due date, we can usually cancel, reject that. And that tells you verification requested. And it does give you a bunch of information here. So this one's looking for life insurance through Fidelity Life. If you see that and you're for sure what it's asking for, again, email me. I can always look up and get more detail. An approved case, you can see that status is active. It tells you when next annual review is. And you benefit information. So this client's receiving Mo Health Net for the aged, blind, and disabled non-spend down with the coverage date of 3/1/18. And if they were spend down, it would give spend down remaining, how much they met, and closed in a rejected case. So this one just shows case status closed, case status rejected. Sometimes people look up a client and it shows no data, as though the system doesn't have them. I'm not sure why that happens. Usually it seems to happen on rejected cases. It's like it's not retaining the information. If you have any questions on status, you can't see them, you don't understand what you're saying, email me. That's why I'm here. So off to Charles.
And I see we had a lot of questions, and we'll try to address some of them. Maybe during what I'm getting ready to talk about, and we certainly will get back to them after this is done and send out answers. Okay, I'm going to talk about the eligibility factors for the age, blind, and disabled categories. There's certain eligibility factors that apply to all of those ABD categories. First, a person does have to be either age 65 or over, blind, or disabled. They're not in those categories. This is not they're not one of those three broad categories of people. This is not the right Medicaid application to use. There's a different application for people applying based on just being a child or being a low-income family or being a pregnant woman. I'm really talking about that today because approximately 65% of our DMH Medicaid consumers are receiving based on disability. Okay, so those three broad categories, the person has to be either a U.S. citizen or an eligible qualified legal immigrant. An immigrant must be in the United States for 5 years to be eligible for Medicaid unless they were admitted as either a refugee or a similar status. The person has to be a Missouri resident, as Anna talked about as she went through the application. It just means, do they currently live in Missouri with the intent to remain here? They someday like to live in Hawaii, but they have no definite plans. There's then a Missouri resident. You don't have a fixed fixed place of residence. You can be a homeless person and still get Medicaid in Missouri or any state. You have to supply your Social Security number unless you're applying for the Blind Pension Program. Medicaid categories for the age, blind, and disabled have some kind of asset limit. All of them consider income, again, the Blind Pension Program. It affects some of the categories for the age, blind, and disabled. It affects the Supplemental Nursing Care Program and the Vendor Medicaid Eligibility category. Age factor, again, for some categories, for supplemental nursing care, supplemental aid to the blind, blind pension, the Ticket to Health Assurance Program, vendor coverage, special income limit category for the HC, aged and disabled waiver, and for the MOCD waiver. We'll talk about these specific requirements later on here. Medical need for institutional level of care. That's a factor for people in vendor facilities, the HCB category, the MOCDD category. The assets, again, applies to vendor. The special income limit category, transfer of assets, also applies just to those two categories. Meaning you pay Security or Medicare taxes. That applies to the Ticket to Work Health Assurance Program. That applies again to the Ticket to Work Health Assurance Program for individuals who have gross income above 100% of federal poverty limit. We have some additional eligibility requirements that apply just for the cash assistance programs for the blind. First, be soliciting alms for either blind pension or the supplemental aid to the blind program. They have received support from a sighted spouse, and that means complete support, that they have no other support. They are ineligible for SSI and supplemental aid to the blind to qualify for blind pension. In the pension program, they have to be of good moral character, which everyone should be, because in order to prove good moral character, you just have to find two people that will sign a form that says you are of good moral character. You state ophthalmologist determine if a person meets Missouri's definition of blindness, which is 5/200, which is a more limitation on vision than a person would to qualify as legally blind. Okay, now citizen immigrant requirements. First, again, to be eligible for Medicaid, you have to either be a United States citizen or an eligible qualified legal immigrant. And SD has to document that you're a citizen. The documentation requirement is either for citizenship and immigration status. An exception to that on citizenship is that if a person is receiving SSI, care, or Social Security Disability Insurance, SSDI, FSD does not need additional verification of citizenship because those programs also verify citizenship. Requirement, FSD does allow reasonable opportunity to provide the documentation after the case is approved. So this is an important thing for you to know when you're working with people. So if they have citizenship documentation readily available, when you submit the application, FD, as they will for anything that's not verified that they need to verify, they'll send a letter out to the client requesting they provide documentation. When you get, though, if they don't have ready access to verification of their citizenship, want to hold up sending in your other documentation, because unless it's really questionable, FSD can approve the case, and then they will give you 90 days after the approval of the application to provide the documentation on citizenship. And that time can even be extended if the person is having a really hard time verifying it. Very easy. FSD has two things to verify citizenship. They need proof of who the person is and they are a citizen, meaning they were either born in the United States or they are naturalized citizen. So for a person like myself, it would be very easy to provide documentation because I'm born in the state of Missouri. And FSD has access to records online all the way back to like 1910 or something like that. So they can look up, they know my birth date, they can look me up, and they can see that I was born in the state of Missouri, therefore I'm a citizen, and I give them a driver's license with my name on it that's the same as on my birth certificate or a state ID. So it's easy to verify. Sometimes for women, it's more difficult because someone might have been born Mary Smith in the state of Missouri. Where it gets complicated, maybe they were born as Mary Smith in the state of Colorado. They've been married and maybe they've been divorced, and so now the name is Mary Jones. So they have an ID that says Mary Jones, and they have a birth certificate that's out of state. So they have something that connects that. First, they have to get that birth certificate to FSD. They have to get the documentation in between that shows that this person has the ID Mary Jones spit out as Mary Smith. That's what can be more difficult, and that's why they do now allow applications to be approved and then gather the documentation after the fact. Okay, for eligibility is based on whether or not the person is qualified or non-qualified immigration status, first of all. Qualified immigrants, some have a waiting period of 5 years. Some can be some eligible immediately. The immigrants who can be eligible immediately are people that are admitted to the United States as refugees, political asylees, there's special status for Cuban, Haitian immigrants, and there are a few similar categories like that. Immigrants that have a 5-year waiting period are people that are just admitted to the United States as lawful permanent residents. Those are the people you usually hear about that have a green card. They can be eligible for Medicaid, but they have to wait 5 years before they can have access to Medicaid. So people admitted as a battered immigrant, they have a 5-year waiting period. A non-qualified immigrant is not for Medicaid at all on an ongoing basis. This would be people that came to the country on a work visa. They're here, that's their status now. They're on just a student visa, perhaps. It would also include people that are undocumented or not here legally. They are not eligible for Medicaid. Now, there's an exception to that for immigrants who are not eligible because of either the waiting period or being in non-qualified status. They can get emergency medical care for ineligible immigrants, I think the two use instead of immigrants. But that just covers, it has to be for a condition that occurs with sudden onset that could likely result in death if they did not receive treatment. It's based on a program that it's more to the hospitals and the emergency rooms that allows them to get bills paid. But it's the immigrant in those statuses, they can get the emergency medical care paid for, but also they'll have to meet the other eligibility requirements just like a citizen or a qualified immigrant would. Asset limits. Like I said, all of the categories for the aged, blind, and disabled have an asset limit. But based on the OA, PT criteria, and the Ticket to Work Health Assurance Program, currently the available asset limit is they cannot exceed $2,000 for an individual or $4,000 for a married couple. July 1st of this year, that goes up to $3,000 and $5,000 Well, either 5 or 6. For the health net based on blindness, supplemental to the blind, and supplemental nursing care, there's a real and personal for the blind. There's a real and personal property limit, which says their assets cannot currently exceed $2,000 for an individual, $4,000 for a couple. That also is up. The Rejection program has a total property requirement rather than an available asset requirement. That is, assets cannot exceed $20,000. The key SLMB and QI programs have an available resource limit of $7,390 for an individual, $11,090 for a married couple. Those are those programs that all they provide is assistance with their Medicare costs. The nursing care program for the elderly and disabled, the resource limits cannot exceed $999 for an individual, $2,000 for a married couple. Supplemental nursing care program is that program that provides cash assistance for people in residential care or assisted living facilities. Home equity requirement of $560,000 for people in nursing facilities or receiving in that HCB special income level category. And for any of these categories, these asset limits, the consumer's home is not considered in determining their available resources or their total property. There's generally an exclusion for one vehicle, typically one vehicle per household. So if you had a married couple, they would allow two vehicles. For the family care categories, which we're really not talking about here today, there aren't any asset limits at all. As I said, till July of last year, Missouri's MoHealthNet asset limit had been, since the program, Medicaid program in Missouri, $999.99 for an individual, $2,000 for a married couple, and for Medicaid based on blindness, $2,000 and $4,000. House Bill 65 passed in 2016 increased those limits, first effective July 1st of last year, and then every year it will go up until it reaches $5,000 for individuals, $10,000 for a married couple. So July, which will really be for applications you're submitting now, they could have $3,000 for an individual, $6,000 for married couples. If assets were above dollars now, they wouldn't be eligible until July 1st, but they wouldn't have to submit a new application. 1565 also excludes health savings accounts and independent living accounts as well as assets. Achieving Better Life Experience accounts. Published under federal legislation signed in December 2014. They allow an individual whose disability developed before they were age 26 to save money in one of these special accounts to maintain health, independence, quality of life without that money that's in that account affecting their eligibility for MoHealthNet, for food stamps, and several other federally funded assistance programs, such as SSI. An aid can be set up through the Missouri State Treasurer's Office, or can also set one up through another state's qualifying ABLE program, but for the most part, Missouri residents would set one up through the Treasurer's Office here in Missouri. They're especially important, I think, for our DD consumers because, for the most part, they all did have disability established before they turned 26. So do have excess assets they would have had to spend or put into maybe some kind of special needs trust. The ABLE accounts are another avenue for them to set aside money for future needs. can be made to the individual client or beneficiary of the account or by a third party, but total contributions are limited to $15,000 per year. So what that means is the person themselves, say they got a large Social Security back payment, they could put $1,000 in that account for their future needs. Also, didn't have money of their own to put in there. If, say, a relative wanted to put money into an ABLE account for them, they could do that. But the contributions from either the person or some other person cannot exceed $15,000 in a year. The expenses are not counted as an available resources in determining eligibility for Medicaid. The contributions that are from a third party and the earnings on the ABLE account are not considered income. So ABLE account, you get in different investment options you can choose. It will earn interest, it will grow, but that growth in the account is not considered income to the person. Also, distributions from the ABLE account for qualified expenses are not counted as income to the person when a person takes money out of the ABLE account. Sure.
Inpatient consumer discharges go to RCF. So does that mean that it is supplemental nursing care and their asset limit is $9.99?
If a person is going into a residential care center or an assisted facility that is licensed by Department of Senior Services, yes, they're applying for that cash assistance program that's going to help them pay for their being there. And so they're going to have to keep their assets under the $9.99 or the $2,000.
Income changes because of a pension retirement being awarded to a married couple. Is it likely for the person receiving Medicaid to be kicked off of their assets total less than $4,000 if their assets total?
Get the additional income, you would report that to FSD. If they get back payment, the back payment, whatever they put in the account, is going to be considered an available asset. So they're going to have to get that down below the couple limit, which is now going to be $6,000. The additional income might affect whether or not the person has a spend down. So it would be both an income change and a change in assets. But if they receive the back payment and then they spend the asset down to below the couple limit of $6,000, they're not going to be kicked off Medicaid. They might change from non-spend down to spend down if there's ongoing income that goes with that back payment. Okay, next. Okay, qualified disability expenses for ABLE accounts. Basically any expense, it's very broad in what you can use the money for. You put it in the ABLE account and you're setting it aside for those expenses related to disability. And there's info about this on the Missouri State Treasurer's website. But you can take money out for basic living expenses. You take money out for housing expenses, for transportation, for education, for employment training and supports, for personal support service, for health and wellness benefits. Okay, a bit about age limits. The Supplemental Care Program, again, which is that cash assistance program for people in assisted living facilities or residential care facilities, a person does have to be over age 21 or over to qualify for that program. For aid to the blind and blind pension, for those are cash assistance programs also. The person has to be age 18 or over to receive coverage in a state mental hospital. the person has to be either over age 65, over, to vendor coverage in a psychiatric facility, which would also include our state mental hospitals. The person can also be under the age of 21 and receive coverage. Health assurance program, for that category, the person has to be between the ages of 16 up till turn age 65. So you have to be age 16 to 64 to be on the ticket to work category. For the aged and disabled waiver that qualifies you to use the special income level, you have to be age 63 or over. MoHealthNet, for the MOCDD waiver, the Sarah Lopez waiver, the person has to be under the age of 18. The definition for Medicaid is the same as Social Security, the Social Security Act's definition of disability for SSDI and SSI. That definition is the person is not engaged in what they call substantial gainful activity, SGA, due to physical or mental impairment, which can be expected to result in death, or which has lasted or is expected to last for at least 12 months. Effective 1st of this year, the SGA limit is $1,180. That goes up annually in January 1st. What that means is that if a person's medical condition is, if they're actually working and earn over $1,180 a month, they're not considered disabled for Social Security disability, and they are not considered disabled for the regular Medicaid program. Next slide. Missouri has chose to have a ticket to work Medicaid category. We call it the Ticket to Work Health Assurance Disability Program. That definition of disability as the regular Medicaid and Social Security and SSI, except it does not have the substantial gainful activity test. If a person is over 1180, eligible for Medicaid, if you have this Ticket to Work Health Assurance category that we've chosen to have. The ticket assurance category also allows a person who has a medical condition that initially met the disability criteria but has improved to continue to receive under the Ticket to Work Health Assurance category as a medically improved person. Disability definition is the same as SSDI and SSI use. If a person is receiving one of those assistance from one of those two programs, they're automatically considered disabled for Missouri Medicaid, and medical records are needed to establish the disability. If the person receiving SSDI or SSI, FSD, current medical information that are submitted to them that will go to their medical review team, MRT, or disability determination. To establish based on a mental illness, MRT is going to require a psychological evaluation that is signed or co-signed by either a psychiatrist or a licensed clinical psychologist. For our consumers who are in the CPR program, the comprehensive psychosocial evaluation, if it's signed by a psychiatrist or a psychologist that has been done within the last 6 months, often, usually, the best psychological evaluation that MRT will need to establish the disability. Go on to the next slide. Okay, and since we do for the CPR program, since we do psychosocial evaluation when they're first enrolled in the program, and then we do them annually thereafter. When the application is submitted, it may have been over 6 months since we actually did the last one. Also, sometimes other qualified mental health professional may have, who not either a psychiatrist or a psychologist, may have been the one that did the psychosocial evaluation, and so it may not have the proper signatures on there. In that situation, FSD will still accept that evaluation and not have to require another evaluation if someone with those credentials, either a psychiatrist or a clinical psychologist, signs a letter stating that he or she has reviewed the evaluation and concurs with the findings, or they can complete and sign the diagnosis certification section of the IM60A medical report form that's available on our website with the MRT packet that Anna referred to earlier. And then they certify that in their opinion the person has a disability. Before we okay, so the forms needed that MRT is always going to need in order to determine disability. They're going to be those forms in that MRT packet. There's the IM61B, which is the disability questionnaire, the IM61C, which is the work history, the IM61E, which is the doctor medical facility list, and MO 650-2616, which is an authorization to disclose consumer medical information to the medical review team. These forms, if he doesn't get these forms, even if they have other information, it'll never go to the MRT team. Because when these come to FSD, they go to somebody who reviews the forms, they scan them into their file room, and just because of the amount of disability determinations MRT has to do, nothing goes to MRT until it looks like to the person at FSD who originally gets the information that it's ready for them to be able to do something with. So if they don't have these 4 forms, it'll never even get to the step that someone will look at it to make the disability determination. Some had the question, well, why do they need the work history on a 10-year-old? Well, probably they don't, but just through the processing, the people doing initial screening, they are not looking that closely at anything. They have a checklist that says, in order to send it to MRT, I need 1, 2, 3, 4. And for that, they're going to send a request for more information. So it's very important when you're helping someone submit an application and they need a disability determination, you make sure you get that MRT packet of forms out as best you can. Okay. In addition to that, they're also going to need a record of treatment. That's basically medical records for the past year. There is a mental illness is the primary disability. They're going to need that evaluation signed by a psychiatrist or a psychologist. They're going to need a global assessment of functioning, a GAF score if one's available. They could use that IM60A form. It's not a required, again, it's not a required part of the MRT packet. It's helpful because it does give a clear statement of the treating physician or psychologist, their opinion as to whether or not the person has a disability. And it's especially helpful when that evaluation that you have is over 6 months old. Okay, and this one here is a screenshot of the actual disability questionnaire. That is part T packet. Now, emphasize on these forms that are in the disability packet. These forms were developed a long time ago when the prior way someone applied for Medicaid was you went into a local office, you sat down at a desk with a FD eligibility specialist, they would ask you the questions and they would fill out these forms. Well, it doesn't really do business that way anymore, where most applications are submitted online or through the mail, and even if you did go into a local office to fill something out, the person you're sitting with is not the person that's going to handle the application. For disability applications, they're going to be sent off to the county office in Springfield. So what you do when you're working with someone is you basically fill these forms out with the best information you have. So like on the disability questionnaire, you need to put the name and the date at the top, name of the person. If you know their DCN, put it. If not, don't worry about that. There's a sentence that says pertinent information and observation of FSD staffs. Just skip that. Leave that blank and just answer the question. The personal information about the person. How they completed in school. What are their medical symptoms, mental health symptoms. Just fill out as best you can based on what the client is telling you. I mean, ideally, I think you would be doing this. You'd be sitting with your consumer, and you'd be asking them the questions and writing their responses down, the best information they have. Sometimes you could possibly, if you've had this person in treatment for a while, you might even be able to complete this from your medical records without them in the office there with you. Because this form doesn't have to be signed by the person, but it gives the MRT some basic information about what their medical condition is. Okay. Okay, I just talked about that. The form, this is the work history form, a screenshot of it. It's a two-page form, front and back. It asks for the work history for the past 10 years. Go on to the next slide. Okay, again, you want to complete this form as best you can from the information the consumer gives you. Don't hold up sending or completing it because you don't have all of the information. I mean, for example, it asks, and it's asking for a 10-year work history. So it asks the name of the employer, what's the employer address. It may, I don't know if it has, yes, it even has the employer's phone number on there. What month did you start and stop? What was your gross income? Not everyone can remember all those kind of details on a job they had 5, 6, 7, 8 years ago. Some people remember a job they had a year ago. So you may have all that information. So it's not important that it be 100% accurate. You just put down the basic, as much information as the client can tell you. You put down anything you don't know, just leave it blank. The important thing is, if FSD doesn't get this form, it'll never be MRT. If they form, they almost never have to really do anything based on this information. Because primary disability is determined based on the medical condition. Talk a little bit about why this sometimes affects things a little later on in the presentation. But for most of the time, this work history doesn't have a lot to do with whether or not the person's going to be determined disabled. But if you submit the form, you won't get a decision.
What if you have filled Social Security and the person has been approved for disability? Can that form be pulled, or do I need to request the form from Social Security? Okay,
back to what I tried to say earlier. If the person is on receiving Social Security disability benefits, FSD does not need any medical records. They do not need the MRT packet. None of these forms, they don't need any of these forms if the person is receiving Social Security or SSI based on disability. If you submitted the forms to Social Security, similar forms to Social Security, but Social Security has not actually made a decision and the person's not received Social Security yet, even told they're going to get it, yes, you do have to fill out these forms separately for the state. Okay. The packet is the hospital, medical facilities, physicians seen in the past year form. Again, it's a front back, two-page form. On to the next screen. Maybe the next one. Again, what the form asks the person to do is list all of the hospitals, medical facilities, physicians that they have seen or received care from in the past 12 months. You should also list on here any mental health professionals they've seen. such as psychologists, licensed clinical social workers that they may be seeing at the community mental health center as part of being in the CPR program. You'd list those places also and those people. Okay? And again, information you can. This next authorization for release of medical records. Now, I know a little bit about this earlier. The next slide. Okay. On this is a form. It was developed many years ago, more recently than those others, but it is a multi-purpose release form for agencies and other places to share information back and forth. But it is what is used to give. We're using it for here is it gives FSD, the MRT, to request medical records from providers in order to get a disability decision. So when you're filling this form out, you start at the top. The person puts I, lists the person's name, authorized, and it's got all these boxes to check. So to check who disclose information. So there you check that you're going to allow Department of Mental Health to disclose information, or you're going to, for our consumers, you're going to check other, especially in the CPR program, like check Compass. So it's giving permission for FS to request information, medical records from Compass. You put the person's name, their date of birth, social security number, if you know it, and the day they receive treatment from this provider. And check who they're going to can release who you're giving permission to release the information to. You would want to check Department of Social Services, or you would check other and write in FSD Medical Review Team. And then this, it's for an eligibility determination. Application to be disclosed. Discharge, progress notes, check as many of those as seem applicable. Then on the page of the form, there's a bunch of disclaimers. One that's very important is in alcohol and drug abuse. So there's specific protections for type of medical records in federal law. So there's a place they need to sign there that they're authorizing release of any records related to alcohol and drug abuse information. So it's important that they sign there so FSD get those records if they need it for MRT. Some of the form, it says my signature acknowledges I have read and understand. Client signs, they date it. They need this only if they're signing with a mark instead of their own signature. If person has guardian, the guardian has to sign the form. If the person with a disability is a child under the age of 18, the parents would have to sign the form giving permission. Then under there's a relation section that they can sign if they want to withdraw their authorization. When you're submitting applications, you don't want to put anything in there because you're using this to get permission to get records. One thing I think we've learned doing these applications is that FD will take this if you don't fill anything on the front or anything on the back except those two places for signature. And they'll fill it out as they need to request medical records from who the client indicated they had medical records from. I was working with the consumer, I would be comfortable in asking them to do that. So I think it's best when you're working with someone, you at least put who, like if you're the community support worker at Compass, helping someone fill it out, you've got them in the CPR program, you want to say permission to request records from Compass. Now, go next slide. Treatment. Again, they want a record of treatment for when mental illness is the basis of the disability. They want that record of treatment that's signed off on by a psychologist or a psychiatrist. A lot of the treatment may be done by a licensed clinical social worker or another qualified mental health professional. They're not going to consider that sufficient documentation. They need something that's signed by someone who's a psychiatrist or a psychologist. Okay. The global of functioning. A person who has a GS score of 50 or under generally will be considered disabled by MRT. If the GAF score is above 50, MRT will still consider the person disabled if they have other information, such as something from the treating psychologist or psychiatrist, that in their opinion, the reason that the person is disabled and the reason for the higher GAF score is due to medication or treatment that the person is receiving. We have had some confusion in the last year or so about the GAF scores. Again, generally, if MRT sees a GAF score below 50, that's going to indicate the person is going to meet the Medicaid definition of disability. However, we're going to be looking at the medical records that come with that. So they are going to be looking at that psychological evaluation, treatment plan. They're going to be looking at the assessment that was done, looking for something that supports. They're not necessarily second-guessing the GAF score, but they're looking for, they want to see medical records that at least they can say support that GAF score. So we have had people where we look in Seymour, we see a GAF score below 50, and MRT determined them not disabled. That is just a legitimate difference of opinion. Sometimes we've had the MRT take a second look at that, and it turned out that they reconsidered and would determine the person disabled. So that's not a guarantee, but it's just a sort of a general rule. Okay. The 60A, the medical report form. Again, this is a general form. It's not a required part of the MRT package, but if you have a psych eval that is over 6 months old, this is one of the easiest ways to show that that is still a current evaluation. So on this one, again, it's designed like you would be setting down. Well, originally the way this form was used, someone was sitting down in an FSD office. FSD would fill in the top part of the form, had the client sign permission to send this form, and FSD would mail it off to a doctor's office. Doing business today is you would know that they might need it, so you're getting it filled out and you're getting it submitted to MRT before they have to even ask for it. So that there's just a few parts of this form that you have to fill out. Again, you put the claim at the top of the form, and then in the first two questions, have you treated this patient in the past year? You want the person to sign this, either a psychiatrist or a psychologist, to check yes, when did they treat them, give this brief clinical history of the condition. Then the rest of this front page, it's not really applicable. A psychiatrist may not have this kind of information, but if their disability is going to be based on bipolar disorder, it doesn't matter what their eyesight is or how much they weigh or their cardiovascular system. So again, it's a generic form for use for all kinds of disabling conditions. So for consumers, generally you just put what is a brief clinical history of their chief condition that's causing their disability. Then on the second page, down towards the bottom, there's this diagnosis section. That's where it's important that you put in what is the primary diagnosis. Bipolar disorder, for example. Secondary diagnosis, if there is one. Any actions they're taking related to their disability. Then just a brief little line to summarize the current findings. What is their bipolar example? How does it limit them? What are they able to do, not do? It's very short. It doesn't ask for not a lot of room to give a lot of information. Next is determination of incapacity, and this is very important as a check. In my opinion, this individual does not have mental or physical disability that prevents him from engaging in employment or gainful activity. So it's not, you're not going to generally get a decision that the person is disabled. So if the treating psychiatrist or psychologist believes the person has a disability, it's important to check does. And since to be considered disabled, you need to have a disabling case lasted for 12 months or more. It's important you check how long duration of incapacity, 13 months or more, or permanent. And the person signs, and this all goes off to MRT. Okay, talk through that. Okay, now this is where you submit the records to MRT. And again, this is part of our rush cover sheet process that Anna talked about here. This is the address of the MRT of the office that actually makes the disability determinations. They're located in Springfield, and gives you an address, an email address where you can submit the application. You can submit the MRT packet. You want to send these things with the rush cover sheet. It is important that if you're submitting them with the rush cover sheet, that it be the first things you send. You can send it to them by scanning the records and email them. You can fax them to this address. You can mail them to this address. Yeah. Say you're helping multiple consumers at the same time. You need a rush cover sheet for each one. You don't want to put John Jones and Mary Smith, even though you're doing them both the same day. Don't put their stuff together. Probably lose track of one of them just because of the way it goes into the system.
So they own rush cover sheet, and they should each be sent in separately. So don't ever send a pile of applications in, because the processing worker will just look at the first one, meaning the other ones will be delayed.
Again, another thing I want to emphasize is when you, especially our CPR consumers, working with the consumer, if possible, if you can go ahead, don't wait for FSD to ask you to send your medical records. Use your medical records department and what your internal procedures are, and ask them to start pulling those records and sending them off the rush cover sheet. So there's ways we would do this, but in the perfect world, you would be able to maybe get the application signed and filled out, get the MT packet all done, and the medical records, and send them all off to this address at the same time. If you do, then it's going to be treated as a priority, and FSD can immediately begin the processing to get to their MRT doctor to make a determination on the disability. You can't wait. Maybe as a medical matter, it may take you a little longer to get those medical records pulled. So you definitely send the application and the MRT packet. And I think as one of those boxes on the form that Anna talked about said, records not being submitted now, but will be submitted at a later time. So go ahead and send the application, the MRT packet, but then as soon as you can, send medical records to MRT with the rush cover sheet. Don't wait for them to ask.
Okay, someone not to use the hospital applications email, which is the correct email. If you're sending in an application with the right cover sheet, you need to be sending it with the cover sheet to fsd.hospitalapplications@dss.mo.gov. If you're not using that rush cover sheet, if they're not a private client, you can send it into any office.
Right. Yeah. The address is FSD Hospital Applications. They originally developed that email address for hospitals that were submitting applications, but they also are now using that from other types of medical facilities, such as our community mental health centers, our regional offices, our DD case management agencies, C-STAR providers.
Someone else, is the rush cover sheet used when we are applying for 22 to 60 for inpatient with a discharge in 90 days or less pre-discharge? No.
There's a special application procedure, pre-discharge application procedures that are in another moment. We have some other information out there on the website about that.
Email us and we can get you that info.
They have the same information. They may need the medical all the same stuff, and we may tell you to use the rush cover sheet to get the medical records in, but don't use it to submit the application. We need to make sure we get it because they have a special unit that does those pre-discharge applications. Okay, now we'll talk a little bit about income and how that affects eligibility. First off, MJBDs. Spend down, non-spend down. Basically, for the Medicaid categories for the elderly, blind, and disabled, you can't be ineligible on income. No matter what it is, you're potentially going to be Medicaid eligible. What's a non-spend down income limit, which is 85% of the federal poverty level, or based on being 65 or over, or disabled, and 100% of federal poverty level for people applying based on blindness. If your income is below those limits, you're going to be eligible as a non-spend. You'll have Medicaid coverage continuously. If your income, you're going to become what FD refers to as a spend-down consumer. Okay. Spend a monthly determination. So a person, if their income is over the spend-down limits, the non-spend-down limits, which for a single individual based on disability is $860 currently. The amount their accountable income after FSD does the allowable deductions that exceeds that non-spend limit, that becomes their spend-down. A spend person, say their accountable income was $807, they're $10 over, they have a $10 spend down. A person $100 over the limit would have a $100 spend down. So it could be, you could have very high spend downs. Now, which doesn't actually begin until they incur medical expenses to meet that spend down, or they also pay in that spend down amount directly to the MoHealthNet division, similar to you would pay in an insurance premium. Okay, if you're so every month, once someone is a spend down, they get an invoice from the MoHealthNet division of Social Services that says your spend down for the month of July is $100. And then they give a choice. Do you want to, and tells them where to pay the $100 spend down amount as a premium if they choose to do that, or if not, it tells them they can submit expenses to FSD. With expenses, FSD will determine the date that their expenses exceeded the down amount and the client's liability for their medical care on the date the spend down was met. If they choose to pay into MoHealthNet, and they do that in advance, so if they pay their July spend down before June is over, and do that continuously every month, They would never have a break in their medical coverage. So to providers, their coverage would look no different than a non-spend-down consumer. There'd be no breaks in their coverage. And if they choose to pay in, they can also choose to pay in by automatic withdrawal from their bank account. Okay. The way they determine countable income for MoHealthNet for the aged, blind, and disabled is that if the person or their spouse, because again, MoHealth applications, it considers the person and their spouse, their income. They disregard the first $65 of earned income. They disregard all earned income above $65. They disregard a $20 personal income exemption. They disregard all SSI payments. And they also disregard health insurance premiums. So all of those things are deducted from their gross income. I want to point out that since they disregard SSI payments, almost receiving SSI should be non-spend down. That means there's some thing with how FS in their income that is different than how Social Security does, because Medicaid in Missouri, non-spend down Medicaid, has a higher income limit than SSI. You would expect SSI recipients to always be non-spend down. So if you ever have someone who is on SSI and they have a spend down, you should contact Anna or I so we can look into it and see, is there some mistake in how the budgeting was done. Okay. Next. Example of how the spend down would be determined. It has $165 of earned income. So first, FSD is going to subtract the $65 earned income exemption, leave them with $100. Then they're going to divide that in two because they're going to deduct half of the income above $65. So that's going with countable earned income of $50 a month. In this, person receives SSDI of $1,030 a month. So add that to the $50 countable earned income. Subtract a personal income exemption of $20. This person to pay a Medicare or other health insurance premiums. So countable income is $1,060. The income is $160 for non-spend down, so their spend down is $200. So if they choose, they could pay that $200 directly to MoHealthNet and have coverage for the entire month. But if they submit it with medical expenses, they would submit to the FSD spend down office. So in the case, the person provides medical expenses, the incurred expenses on March 3rd from provider of $150 for a service. On March 5th, they received another service for $60. On March 5th, they also received an $80 service from provider B. So they didn't be down on March 3rd because $150 was less than the spend down amount. But 5th, their total expenses are $290, which exceeds the spend down. So the spend met on March the 5th. FS then enter coverage into the system that shows that their coverage begins on March the 5th with client liability of $50 for March the 5th. Any submitted to MoHealthNet prior to March 5th will be denied because they have no coverage prior to March 5th. Any committed to MoHealthNet from March 6th through the 31st would be paid just like they would for a non-spend down consumer. For any claim from the first claim that's submitted for March 5th, that division will subtract the liability of $50 from that claim and pay the remainder of the March 5th claims. Okay. The spend down unit. So if you expenses to them, they have use your own invoices or bills, They also have their own spin-down provider form that you can fill out, and you can send it to the FSD spin-down unit by fax, by scan and email, or by mail. The phone number, addresses are on this slide here. Insurance program. Again, it's a program to encourage or help people that want to return to work even though they have a disability. Has a higher income limit. It actually has two income limits. It's both a gross income limit, which is 300% of the federal poverty level, which is $3,035 for a single person, $4,115 for a married couple. It also, the net income limit, which is 85% of poverty, which is the same as the spin-down limit for Mobile Health Net for the disabled. However, additional deductions that you don't get for the regular Mobile Health Net program for the disabled that you get for the Ticket to Work program. With the Ticket to Work health insurance program for people with gross income above 100% of poverty, they have to pay a monthly premium to obtain coverage. Always that monthly premium would be less than if they had to meet a spin-down. To detect income for Ticket to Work health insurance, that you get for the regular MHABD program, you'll get additional deductions. First, in doing that income determination for Ticket to Work, they disregard all of the earned income of the disabled worker. So the income is counted in the net income determination would be is if the disabled worker had a spouse in the home. They would count part of the spouse's earned income, taking off the earned income deductions, but not count any of the earned income of the disabled worker. They also allow a standard deduction for impairment-related employment expenses that is equal to half of the disabled worker's earned income. So even though the disabled worker's earned income isn't counted, a deduction from their income based on how much they're earning. So for example, if just has a job earning $200 a month, they're going to get a deduction for impairment-related expenses equal to $1 that will be deducted, say, from their Social Security disability income. They also discard the first $50 of SSDI income. Now, a standard deduction for optical and dental insurance of $75 if optical and dental insurance costs less than $75. So you buy a $10 optical dental policy and get a $75 deduction. For a regular Medicaid program, they just deduct whatever the premium actually is. Next slide shows what the premium amounts are. There's 4 different premium levels for both single people and married couples. Below 100% of poverty, you have no premium. If it was between 100% and 150% of poverty, it's a $40 a month premium. Next level is $61, then $101, then $152. Okay. This shows this married couple. So a married couple, and one of the persons is a disabled worker applying for Medicaid under Ticket to Work. This premium they'd have, since it's a couple case, but it would only get coverage for the Ticket to Work program. If you married couple and they were both eligible under Ticket to Work, they're both employed, then premium though would be the premium that would cover both. It'd be a $55 premium to coverage for both. Next slide. Okay. Okay, this is a slide we kind of go over how you can kind of know how whether someone's going to be eligible for work Medicaid. If you have a person who, without any earned income, they can spend down Medicaid anyway, or they'd have a spend down of less than $50, how much they get, if they get a job earning even $1 a month, meet the criteria to be eligible for Medicaid under the Ticket to Work category. So spend down before, they'll be eligible for Ticket to Work. $1, or they're, as long as they stay under the gross income limit, or $50 spend down. If $50 spend down, a $10 a month job can make them eligible for Medicaid under the Ticket to Work program, because immediately get $50 subtracted from their unearned income. If they have a spend that's above $50 before they go to work, they basically have to get a job that they're going to earn double the that their spend down exceeds $50. For example, if they had a $100 spend down, they'd have to have a job paying $100 a month to qualify. And we have an example that'll show you how that works. This much if they have health insurance premium, dental and optical premiums. So this is kind of sort of based on the example with the spend down, non-spend down works. So the person, before they went to work, had a spend down of $200. They would get a job paying $300 a month to be eligible for the Ticket to Work health insurance program. So decided to go out and buy dental and optical insurance, and they would just need to get a job paying $150 a month. So if they had been down before, they get a job paying $300 a month. They're going to run the Ticket to Work category, and their premium would be $40 a month, and a spend down of $200. So basically what this does, it shows that this $300 a month actually increases their available income by $460 a month. Because what they pay for their Medicaid coverage goes down, plus they have the additional earned income. Go next slide. Okay, so since this is kind of a complicated little budget and formula to follow and understand, we have developed a Ticket to Work health assurance calculator that's available on the DMH website. This slide shows you where you can find that. And you use that calculator to enter in information about your consumer, and it will show, if you're trying to help them decide how much do you need to work or what do you think, it will show, the calculator will then show, will this job they're taking make them eligible for Ticket to Work? And if so, what would the premium would be? If the job that's not going to make them eligible for Ticket to Work, it will show what does that job do to their spend down, and well, their spend down's increasing, but at the bottom of this calculator will show well how little income they have. So even if they don't go to work, just because of the way our income deductions work, they're still going to come out ahead by having this job, even though their spend down will go up. Next slide. Okay. Coverage begin for all Medicaid categories for the elderly, blind, and disabled, and Medicaid in general, except the QMB program, and have to meet a spend down or pay a premium. Med will always begin on the first day of the month of application if the client is determined eligible, and they request coverage for the prior 3 months. It can go all the way back to the first day of that 3-month period. Information. A lot of this information, including this PowerPoint, or an old version of it, and we'll have a new version of it out there. And your Medicaid information is available on our DMH website under mental illness and under drug and alcohol abuse. This tells you how to find them there. A lot. And if you have questions about this presentation or Medicaid eligibility. This is my contact information. This is his contact information. For our DD agencies, they also have this special email address that you'll use. It says DD Medicaid Reinvestigations, but it's used for just general eligibility questions.
Right, and then I checked that mailbox, but it's also checked by some DD people here in the building, so it's a good place if you're a DD person to contact. That way they can see it as well.
Okay, that's it, unless we have any questions else that we need to address. Okay, all right. Thank you all.
As mentioned, the information, the recording of the webinar, as well as the presentation, when it's available, that will be sent out Division email blast. If you're not signed up to receive our email blast for the Division of Developmental Disabilities, if you go to our webpage, on the right side of that landing page, there will be a yellow rectangle box. Click on that. It will take you to sign up for Division email blast. Also, we have captured all of the questions that were submitted through the chat box and the Q&A. Those will be compiled, and we'll make sure that you have availability to those questions and answers as well. There will be a very short survey pop up in your window at the conclusion of this. If I remember correctly, it's only 3 questions, so if you'll take a moment to complete that, we appreciate that very much. Thank you.